Welcome to Leadership Chats with Dr. Wise, the Not a Lecture podcast where we explore what it really means to lead in today's complex healthcare environment. I'm Dr. Wise, and in this series, we're having real conversations about essential leadership concepts. We'll talk about what you need to know, what you want to know, and what you'll actually use in practice. And yes, what you need to know to pass the exam. Each episode, I'll be joined by a guest expert who brings real-world experience and insight into nursing leadership, from managing care teams to fostering a culture of safety and everything in between. Whether you're listening on the go or settling in with your notes, this is your chance to deepen your understanding and connect what you're learning to real-world practice. No slides, no lectures, just meaningful conversations that bring leadership to life. Welcome back to Leadership Chats with Dr. Wise. I'm Dr. Wise, and today's episode is all about something every nurse needs: effective communication, especially when things get tense. Today, I'm joined by Dr. Jason Weber, and we're talking about conflict resolution and how to recognize it, how to respond to it, and how to lead through it. From understanding the different types of conflict and the stages it goes through to using assertive communication and knowing when to file a grievance, we'll cover the key strategies that help manage tough situations while keeping your cool and protecting your patients. Whether you've nailed the art of communication or you're still figuring out how to speak up and handle tough moments, this episode's here to help you build confidence and lead with clarity. So let's get into today's chat. Welcome, Dr. Weber. It's so good to have you, and I'm looking forward to our conversation. So to get us started, why don't you start off by telling us a little bit more about yourself?
So I thank you. First off, thank you for having me. I love podcasts. I love doing this kind of stuff. But about me, I am currently the Vice Chancellor for Leader and Culture Development at the Texas Tech University System. So what does that mean? I'm a facilitator. I'm a people developer. I have the pleasure, the honor, really, of working with all of our universities. So Texas Tech University Health Sciences Center, both in El Paso, in Lubbock, in Abilene, in Dallas, and all of our great locations. Wichita, Midwestern State. Wow, I messed that one up. Midwestern State University, Angelo State University, and of course our flagship TTU, Texas Tech. So I lead a team that we focus on character development, values development, and really just helping leaders become successful. And so this topic is very timely and is an important one that, like you said, could take many hours to discuss.
Yes, yes. Yeah, we could definitely spend all afternoon talking about this, but I know we'll have to keep it to a short time. So, to kick things off, let's start with conflict in a broad sense. So, you and I both know this runs deep, but we're going to take about 45 minutes or so and see how much of it we can squeeze into this time. I have a feeling we can cover some really important things. So, we'll get started with looking at the big picture and having a general introduction to what conflict is. So, why does conflict always seem to get a bad rap?
Well, think about it. How many of you who are listening like conflict? Very rarely do I have people stand up and say, I love conflict. And I think, at least in my experience, and I'll add a little context when I talk about my experiences. Out of college, I started in law enforcement. So I was in law enforcement for 9 years, and then I moved into higher education, et cetera, et cetera. And now here I am at Texas Tech. But that was a very unique experience to conflict. The majority of the people that I worked with day in and day out were not having a good day. And so conflict was inevitable. It was a part of it. And I think a lot of times when we think about conflict, it automatically goes negative. We automatically think this is you and I not agreeing on something. Maybe I'm not getting my way. Maybe you're not listening to me. You're not doing what I want you to do, whatever it may be. And we don't leave much room for this idea of healthy conflict. Many authors out there talk about the need, especially in teams, that we've got to be able to have disagreements. We've got to be able to have the opportunity for us to view things on different levels. I believe that we've become very comfortable looking at things, especially around conflict, as right or wrong, good or bad. So it's almost an either or, when in reality, I believe we need to look at it as kind of a both and.
Mm.
You and I are not going to always agree on things. That's okay.
Mhm.
We can still be professional, we can still collaborate. One of the things that I know we'll expand on later on, but one of my favorite things to ask teams, do you have to like the people you work with? And while I usually get a lot of smiles and laughs, the answer to that is no, because there is no work rule. If we go the HR route here, there is no work rule that says you must like the people you work with. Instead, we have work rules that say you must be professional and respectful, things of that nature. That's an expectation, that's a standard. And I think a lot of times we bring our personal perspectives and we expect others to view those as their truth as well. So, right there, just saying that, there is a natural, almost automatic conflict that's going to emerge. So while we want and we aspire, and I think many of us are fortunate to be in environments where we get along with our peers and we do like them, the reality is we've got to be really clear on understanding of those expectations. So to bring that all together, I think a lot of why does conflict get a bad rap? I think we've all had negative conflict. I think we've all experienced and we didn't like it. It left a bad taste in our mouth, right? And because of that, I feel like too many times we put up barriers or we put up walls that prevent us from seeing what's the other side and what potential advantages might arise from conflict.
That's such a good perspective and a good way to help us look at it from a different lens. So it really is not always a negative thing, and it could actually end up being helpful at times, especially as we work through different challenges that arise. And it's not necessarily even challenges um, between individuals; it could be challenges in a system or something, that
Mhm.
we're all working on together. And by taking a moment to work through whatever that conflict might be in a productive way, we can come to a better outcome in the end. So that's very helpful. So, how do you, for you, how would you define for us conflict in a professional setting? And yeah, let's start with that. How would you define conflict in a professional setting?
Yeah, misaligned expectations.
Mm.
Misaligned expectations. One of the models, and Dr. Wise, you've heard me talk about this a lot, is this idea of viewpoints, and that we all bring assumptions with things that we believe to be true, whether or not we have all the facts, the info around it. We all bring different perceptions, the lived experiences, and I already gave you a unique perspective on mine. But then there's the expectation. So the three elements: assumptions, perceptions, and expectations. I believe that conflict in a professional setting is misaligned expectations. We have a responsibility when we're working in a team to level set, to make sure that we are um, for lack of a better term, level setting with our peers to say, when you think of conflict, what does it mean to you? When you think of effective communication, what does that mean to you? If we don't have those discussions and if we don't level set, then we're creating the space for conflict. This morning I was attending a certification training. One of the tools that we use when working with teams is the working genius, and this comes from the table group. Pat Lencioni, he wrote a lot of great books out there, The Five Dysfunctions of a Team, and all these other things. And their assessment, the working genius, is all about helping people understand how they work and then how they work together. And one of the facilitators, his name is Tim Cooper, made a statement, gave us a quote today that I thought was so powerful and very timely for our conversation today when he said, healthy relationships aren't fragile. Fragile relationships aren't healthy.
Mm.
We undermine relationships when we treat them as fragile. And I think a lot of times we operate off of this idea, especially in the workplace. And, I think back, so my mom was a nurse. And so I grew up. While she went to nursing school, I was the one sitting in the hallway being told, don't you dare make a noise. And then, while she was working in the emergency room, did home health care, I would go on visits with her and all this stuff as I was a kid. But you think about the different environments that you all are in, right? And so many times we don't work with the same people, especially, in an emergency room setting. You may get called here, boom, you're working with the team, now you're working with another team. So let's take what I just said. How do you actually level set? How do you set those expectations? That's the challenge we run into, right? And again, I know during our time together, we're going to talk about strategies, we're going to talk about all that, but I just really want to highlight the complexity of it. So in a workplace setting, misaligned expectations.
Mm, that's so good. I always think every time I hear something about misaligned expectations, I can hear my mother's voice telling me her wisdom. But she used to always tell me that when we can expect that our expectations will not be met when they're not expressed. So we have to figure out what our expectations are of each other in a constructive way. And like you said, we'll talk about some of those strategies, but it can make all the world of difference and turn those conflict opportunities into more constructive opportunities to help the team. So as we look at conflict in a professional setting, how can we transition? We have misaligned expectations, but how do we keep that conflict as constructive?
I, I go back to this idea of we've got to be willing.
Mm,
And here's what I mean by that. I want to bring in a faculty experience, but I believe it connects. I was talking to a faculty member, and we were discussing some of the challenges they were having in their team. And he brought up the point, he said, how do I navigate this when my job requires me to be an individual? I do my own research. I have to do my own community service. I have to do my own stuff to hopefully one day get tenure, right? It's a very individual journey. But yet, I'm required to collaborate and work with others who aren't on the same journey. Here's how I connect it into the nursing field or just the professional world. We all have a passion. We all have something that we're wanting to accomplish in life. Our passions aren't going to be the same thing. And again, that's okay. So I go back to that word willing because we as individuals, as leaders, as people, we have to be willing. It's something that ebbs and flows. We've got to be willing to give a little. We've got to be willing to say, maybe this isn't the time for them to understand my perspective completely. Maybe it's a safer zone, a safe time, kind of down the road. So I think how do we keep it constructive is willingness. We need to remind ourselves that, listen, we control ourselves. I can't control you. We control ourselves. And so what we can control is our mind, our emotions, our thoughts. There's a quote, and I can't remember who it's attributed to, but it pops up every so often, and it's an impactful one that says, nothing is good or bad, but thinking makes it so.
mm,
Now, again, I come from a law enforcement background and you a nursing background. There are plenty of things that I say, that we could all agree this is not good.
right,
But we've
right.
got to take the essence of it, is that our mind is a powerful thing. And we've got to be willing to look at a situation. Maybe somebody responds sarcastically. Maybe somebody does something that we asked them not to. The emotion starts here, right? People don't make us mad. We make ourselves mad. And
Mm.
so we've got to remind ourselves of that. And so again, how do we keep it constructive? We've got to be willing. We've got to be open. And we've got to remind ourselves no one's perfect. No situation's perfect. Um, so that's where I'll stop there for right now.
Yeah, that sounds great. It's a good, I think it's a good, as we're talking about kind of an introduction to conflict and how to look at it, we've taken a moment to kind of reframe how we're looking at conflict. It's not always negative, and I think that willingness is a very important perspective to have when we think about making it constructive. So, I really appreciate that, and I like it. So, okay, so let's talk a little bit, get a little bit more practical here and talking about understanding the types and stages of conflict. So, can you walk us through the types of conflict? So, we've got intrapersonal, interpersonal, and intergroup. Tell us a little bit more about those and maybe some examples to make them a little bit more applicable.
So intrapersonal starts with you. This is something that I talk to leaders about all the time is no matter there was my executive coach. And so I have the opportunity to serve as an executive coach, but I also have an executive coach. And she gave me a statement the other day that really resonated that said, a team can only go as far as a leader's mind is willing. And so it's something to think about where, again, it always starts with us. It comes back to us. And so when we think about intrapersonal conflict, right, this is that internal struggle that we are all going to face. Maybe we desire something, but yet, if in order to do that, we've got to make a sacrifice, right? So there's a great example. Maybe I want to move up the career ladder, but if I do that, that's actually going to take time away from family and all this other stuff. Personal example. So my wife and I, we have 5 kids. She's a stay-at-home mom and was a stay-at-home mom until my oldest hit 16, and then she said, I'm done with that. And so she's like, I got to be around people. And while she was a stay-at-home mom, we knew that that was a privilege, but it was very difficult. I wanted to accomplish so many things, like professionally and all of that. But it's not that I put them on hold. I had this intrapersonal conflict because we had bills to pay. We had a rent due, we had all this other stuff. And so I had to make the choice where in order to do that, I worked a lot of times 3 jobs just to make ends meet. I wanted to be home. I wanted to be with my kids, with my wife, but I had other things that were out there. So there was this intrapersonal kind of conflict that I had to kind of navigate. So again, intra is more the internal. We think about interpersonal, that's between people, right? Maybe I walked in, said good morning, and you were like, nah. Well, okay, now I'm in a bad mood. Now you and I have an interpersonal conflict, right? Honestly, it's as simple as that. It's amazing. It is one of my all-time favorites, and I'm sorry, I'll stop these little rabbit trails. One of my all-time favorites was 2 employees that were in HR, and I was there mediating because one was mad at the other because the other person was breathing too loudly.
My goodness.
Anyways,
You could
moving
take
on.
anything.
So interpersonal conflict, again, maybe it's just simple disagreements, right? We see a lot of incivility in this area, right? I think in extreme cases, this is where you'll get bullying. Again, these are things that I hope people don't have to deal with, but unfortunately, I know they're truths, they're realities in the workplace. But interpersonal, again, you and I just aren't getting along for whatever reason. A lot of times that is a communication breakdown, it is a perception breakdown, misaligned expectations. Intergroup is between 2 or more groups. So a great example. So being at the system level, I very much approach my job because I have to at an enterprise level. So when I'm making a decision, when I am rolling out a new initiative, I'm looking at how is it going to impact Midwestern? How is it going to impact Angelo State? How about Texas Tech Health Sciences Center? And there are, on a normal occasion, that regularly happens, there's an intergroup conflict between a team at one university and another. And so we've got to be able to navigate that. So depending on where you are, what's the vantage point you're taking? So intra, self, inter, between, and intergroup will again be between those 2 groups. And that could be financial, resource. It could be a lot of different reasons for that.
Yeah, those are great examples. Thank you. And great ways to apply it to make it a little bit more tangible. So we teach that there are 5 stages of conflict from latent through aftermath. And so just to kind of spell out the stages, we have stage 1 conflict, which is going to be latent conflict. Stage 2 is perceived conflict. Stage 3 is felt conflict. Stage 4 is manifest conflict. And stage 5 is conflict aftermath. So, can you kind of step us through those stages, give us a little bit more context and information to understand those better?
Yeah. So the easiest way I can think of latent conflict is as I'm kind of viewing the world around me, I'm looking at something like, I don't like it. Like there's just kind of a personal, I don't like it, right? Maybe you hear about a new software scheduler or technology, and you're like, I don't like it. Very common with change, right? Early stages of change, we see a lot of resistance where people will have a kind of this personal reaction to it. So latent conflict is it's not that there's an actual conflict, it's just more felt, like in my mind, right? I'm starting internal. So in my mind, I'm looking at something and going, yeah, I don't like that. That would be an example of a latent contact. Perceived conflict. I want to call out that word perceived because if you remember our viewpoints, the second one was perceptions.
Mm.
Perceived conflict is again a viewpoint. And so if all of a sudden, let's just say you and I are sitting in a meeting room and we're listening to the presenter and they say something that about a change. And Dr. Wise, all of a sudden you stand up, you slam your chair in, and you walk out. I'm perceiving there is a conflict between you and that person or something that was said, when in reality, this it could be something completely different. Right? So perceived is going to be that perception. This, another real life example of this is when we say, why do you treat them that way, but not me? We have a
Mm.
perceived notion. My wife uses this one a lot. So she will leave work. She takes her lunch at a really odd hour to go pick up our kids from school to bring them home, right? Well, one of our coworkers got mad because they're like, why do you always get to leave early? Well, what this employee didn't realize is, yeah, but she wasn't taking a lunch. And when she came back, you actually already left because they have offsetting hours. And so it's not that, it was just perceived because we don't have the full picture.
Mm. That's a good one.
I'm sorry?
And that's a good example of we perceive a lot of things
Oh
that
my
may not
gosh.
be true to reality.
And let's just say a coworker comes in late and we're like, why did they get to come in late and nothing was said to them? Well, we don't know what actually was happening. So again, our mind is a powerful thing. So we've got to be
Hmm.
careful with that perceived. The felt conflict. I want to bring in a great example that comes from Crucial Conversations. So there's a great book. It's got a red cover. It's by a company called Crucial Learning, and it's Crucial Conversations. It's one of the most popular books out there, and it's one I would highly recommend if you're a reader. Add that one to your library. It's a good one. In there, they talk about the communication pathway, and that fits really well with the felt conflict stage. So, felt conflict, let me kind of get a little bit specific. This is where we begin to feel an emotional response. So, you're doing something and it's kind of aggravating me. Perfect example. So, I got an email the other day from someone, and they included a joke. I didn't read it right. I felt like there was a conflict. So I had to go talk to them, right? But that's an example. What's that feeling that comes out of it? The Crucial Conversations book gives a conversation, a communication pathway model. And the model looks like this. If you can imagine an arrow from left to right, the very first step whenever we're engaging in communication is see and hear. So communication begins from when I'm seeing you and from what I'm hearing, right? It's all the different types of communication we have. When we see and hear something, the second stage, that next stage, is tell ourselves a story. So if I see something, I'm going to tell myself a story. Now, here's the thing, it happens in a split second, right? If I all of a sudden stopped our interview and I just looked over here, and didn't say anything, you're telling yourself a story about what I'm doing, about
Hmm.
what could be over there. Nothing is over there, by the way, but you don't know that because we're not here. So I'm telling myself a story. Oh, Jason's not engaged anymore. He doesn't care about this, but you don't actually know. So again, we see and we hear, we tell ourselves a story, and that happens so quick. From that story, we begin to feel. And that's where, again, we run into this felt conflict, right? When I see something that I don't like, maybe I get angry, maybe I get upset, maybe whatever. And this is where our emotion really starts to take control because then we go to feel and then we go to the final stage, which is act. So to
Hmm.
put it into perspective, we see, we hear, we tell ourselves a story, we feel, and then we act. And so the felt is again that emotional aspect of it. And so we've got to, again, understand all the elements that everyone goes through. The fourth stage is the manifest. This is where, again, people, they're going to be involved. They're going to be aware of the conflict. Action is taken. And so, again, we agree there's a difficulty. So this is manifesting conflict. So it's actually happening, right? And so then what we want to do after that is the aftermath. And this is where we choose. This is where we choose the route we want to go on. So we had our conflict. We're either going to go a positive route or we're going to go a negative route. Positive route is I'm going to be willing, I'm going to be open, we're going to come to a solution. Negative route is going to be I'm going to take it personal, I'm going to hold a grudge, I'm going to get even more mad at them, whatever that may be. So those are the five common stages that we see, and I hope from that you could kind of see the progression and how it builds from it starts with our mind, and then it goes into our emotions, and then we act on it, and then we've got that aftermath where we've got to decide how we'll respond.
That's a great explanation. And so I think one of the things that comes from understanding each of those stages, because I think in my mind, I think about, once we hit that emotional stage, and depending on the nature of the conflict, that's when things can start to get a little risky. Because if we start to respond with our emotions, then that aftermath could not be so good. So, are there any key warning signs that we should look for throughout those stages or at any particular point that you would advise that would help to intervene before a situation starts to escalate to a point that would be too far?
Yeah, so there's one of my favorite ways is know thyself, right? Know yourself. Get to know yourself under stress. That is a strategy that we learn from the emotional intelligence field. Get to know yourself under stress. When somebody says something that is rude or disrespectful, how do you respond? When somebody does something you don't like, how do you respond, right? The goal is I want you to get to the point of I want you to get away from reacting and I want to get you to responding. Reacting is that immediate, whereas responding is I've taken even just a second to think about how do I want to show up? How do I want people to know me? Right? What is the example that I want to set for others? So know yourself, get to know yourself under stress. Secondly, no one's perfect. You're going to make mistakes. You're going to say things. You're going to do things. There have been plenty of times I've said something or I've done something, and as soon as I'm done with it, I go, yeah, I probably shouldn't have done that. So now I've got to go and apologize and do all this other stuff. So it's not going to be perfect. So don't try and aim for perfection here. But then, we've got to think about um, pay attention. You're going to see conflict all around you. Learning is all around you. And so I would encourage pay attention. Watch how other people deal with conflict. What did you like? What didn't you like? Do some debriefing in your own mind, right? What did I like about how I handled that? What didn't I like? Maybe talk to someone you trust. Hey, you watched that go down. What could I have done differently? So it's all about awareness, knowing who you are, and then finding the avenues to get that feedback and development that works best for you.
I like that. And, awareness of ourselves can help in so many areas beyond just conflict, but absolutely. I think we're better able to, I know from my own experience, when I take a moment to kind of reflect on how I handled a situation or how I know I'm going to, it sure makes the future conflicts that find myself in more manageable. I'm one of those kind of people that I don't like conflict at all. I would like to run as far and fast as I can from it, but that's life is, we can't do that sometimes. And there's challenging situations that have to be handled. So over time, I've learned how to manage more of that I want to run away situation to where I can respond more effectively or in the right timing or whatever it is. So that's absolutely essential, especially as developing as a professional. Our students are getting ready. They come with various professional backgrounds, but they're getting ready to enter into a profession of nursing. And I think that's very essential to being the best professional and team member that you can, or even providing the best patient care, because some of those conflicting situations are going to be between patients and their families. And those are some make or break moments in themselves as well. So Um, I think that works great segue into talking a little bit about conflict resolution now, more in a nursing context. So I recognize that you're not a nurse, but I think you have some great context from your mom and the experiences you've had with her, and then working within our health sciences center. So I think that this will you'll bring great context to the way we're going to look at this. So from your perspective, how is conflict resolution different in healthcare than in other fields?
Yeah, this one, really thinking about this question because I believe there's a lot more at stake in the nursing field. Think of the environment, think of the outcome. What is your end goal? It's patient care. It could be somebody's life on your hands. And so, how we navigate conflict, I believe, is different. It's a higher level of risk and a higher level of importance there. However, how we navigate and how we deal with it, in my experience, whether it's in the oil and gas field, IT, business, construction industry, higher ed, law enforcement, all of that, it's very similar. And it comes down to the ability for us to effectively communicate. What are we willing to do? Are we willing to negotiate? Are we willing to persuade? Not coercion, not manipulation, right? But that ability to say, listen, we have the same end goal. How do we need to get there? I'm not always going to get my way. Sometimes I might, sometimes I won't. And so I think it's what's important is when we think about conflict resolution, I would add this: someone's got to start. That's been another really interesting thing that I've noticed over the years is that a lot of times, Dr. Wise, you and I may have a conflict with each other, but a lot of times I don't want to upset you. I don't want to make you mad. And just like you said, you're not a fan of conflict. So you're probably not going to be the first one to start it as well. Someone's got to start. It's amazing to me how many times a conflict is perceived, yet when someone talks about it, they're like, "Oh yeah, that wasn't bad at all." Don't make it bigger than it really is. Please don't make it bigger than it really is. Your mind is a powerful thing. And I'm going to make an assumption that a lot of those of you who are listening have had those moments where, in your drive into work or the night before work, you've gone through your mind, a role play in your mind about how horrible conflict's going to be. And in your mind, you're like, oh, I'm going to get them. I got them and I know what I'm going to say. But I would ask you to compare it to reality, compare it to what actually happened. And how many times have we been like, oh, that wasn't so bad? Or that didn't go the way that I thought it would. So when we think about, again, how we handle it, there's got to be a willingness and openness to be able to talk. It's kind of like how it's helped me and how I've made sense. It's like feedback. You can give me feedback. It's my choice to decide what to do with it. I can give you feedback. It's your choice to decide what to do with it. Conflict is kind of the same thing. If I know and I believe that, listen, I can't control you, but I've got an issue with you, then my job is to say, Dr. Wise, I need to talk to you about something, that's really been frustrating. And I can share it with you. But what you do with it is what you do with it. I feel better knowing that I spoke my piece, right? I also want to call out what I just did there. I used a lot of I language. Own it. Be willing to own it. If you have a frustration, then you have a frustration. Not, I was overheard someone talking that they were upset with you, and I just wanted to talk to you about that because I thought it was interesting that they don't play games here. Don't pass the buck. Don't, play mind reader. That I don't know of a single conversation that's gone well when you walk up to someone and say, "Do you know why I'm mad at you?" I've never seen that one go well. And I'll be right there running with you if someone says that, especially my wife. But take ownership, right? Set your expectations, level set, be willing to negotiate, be willing to be flexible. So those are some of the key things that really stand out for me.
That sounds good. And I really want to highlight that point that you said at the beginning too, and the fact that communication is necessary in every field. And I can absolutely see what you're talking about the nature of communication and conflict, no matter where you're working or what team you're on. But the essential piece that is important in what we're talking about is that we have people's lives sometimes in the middle of the conflict. And that can really take that conflict from low stakes to high stakes real fast, and really make us think twice about how we're handling it. So We often are going to encounter conflicts with patients directly or also their family members and their caregivers. So, have you ever witnessed or navigated a situation where emotions were running really high? Because if you think about this context of a patient situation, if a patient's in the hospital, likely it is not their best day. They are not feeling that great. And there's a lot of emotion involved. Same with family and caregivers. Their conflicts stem from a deep sense of love or care, whatever it is for their family member, and those emotions start to influence the conflict. So tell us, give us a little insight into navigating situations where emotions run high and strategies that we can use successfully to de-escalate those situations.
Be patient and level your emotions. I recently experienced this. So, Dr. Wise, you know this. Last month, my mom got really sick, was put on hospice care, and unfortunately passed away. But when we were in the hospital, we ran into some conflict. And um, the issue we were running into is the nurses we didn't believe were being honest with us. It felt like they were sugarcoating a lot of things. Now, I understand the nature of it, right? I completely, do that, but my dad was getting really frustrated because he was looking for an answer and not the answer, just a answer. And he kept meeting this wall. And so when I went in there, of course I was emotional too because it was my mother, right? But um I approached it where I saw what my dad was doing. It wasn't working because he was getting angry, he was getting upset and all that. And the nurses did a good job, kind of keeping me in line. But I went out and I said, listen, I understand there's a lot of emotion going on right now. All we're seeking is clarity. That's all we're seeking. What clarity can you give me? And so when I approached it in that calmer sense, and my dad wasn't in a place to be able to do that, I got a much different response. And then when it came time to make that decision that we needed to put my mom on hospice, one of the doctors came in and said to my mom, and she said, "What is wrong with me?" And the doctor said, "Oh, there's some issues with your liver, but it'll be fine. We'll look at it." That's what he said when her liver was less than 10% function. She was not going to survive this. And my dad and I were just like, "What is happening? Like, why would you do that?" So when he left, I walked out and I said, "Listen, I don't know why you did what you did, but I need you to know I know what the outcome is going to be. I just need clarity. That's all I'm asking for." And unfortunately, it wasn't that doctor. It was a different doctor who said, "Let's go talk. Let's go sit down." And he walked me through kind of line by line. So I think in those moments, especially in the heat of the moment, the best way that we can respond when we've got families that are upset, maybe we have patients that are upset, calm your emotions, know yourself, right? And speak calmly. One of my favorite questions that I give to leaders is asking people, what don't you know that you'd like to know? What's the information you're seeking? Because again, in my mind, I'm communicating clearly. In their mind, I might not be. That's because our expectations are in two different places. So, what I would offer as somebody who was the family of a patient who went through that very recently, from my own experience in law enforcement, dealing with very high stress situations and all of that kind of stuff, and even how I transition that into leaders today, is watch the expectations because you may think you're answering their question, but did you really listen? Do we really know what they're looking for? And so again, being willing, there's kind of that key theme there, being willing, being open to saying, listen, what don't you know that you need to know? Is there something that I can do? Because, and you know what? Maybe you can't give the answer, but I would rather know that, I'm not the one to give you that answer, but we'll make sure the doctor tells you. That would have worked wonders. Any little bit helps. So again, understand, listen, emotions are hard. It's an emotional thing. It's difficult all around, but the more balanced we can be, the more focused and calm we can be on our communication, and the more patient we can be, the better it's gonna turn out.
Yeah, I think that patience is absolutely key. And something comes to mind as you're talking about this too. I know that you talk a lot, and I recently heard you talking about in a training that, we have to, I think when we're on the healthcare provider side of things or the nursing side of things, we really need to kind of pause in that patience and try to understand the true intent on the other side with the patient and their family members, because I don't think in most cases the intent is that they want to be rude or angry or aggressive to a healthcare provider or the nurse. They're not trying to hurt you. They're just frustrated, or they're experiencing, potential loss, or they're confused. I mean, I think it's easy as a nurse to take for granted the amount of healthcare knowledge I have that provides so much comfort in a situation with a family member. So, I don't know if there's anything you want to add on that, but that concept of, what's going on in the background with this person, or what is their true intent and what their behaviors are, because maybe their behaviors don't align with their true intent, or they're just so their behaviors or their words are just so strongly influenced by their emotion that it's clouding out what the true intent is of the situation.
I think one of the other areas is there's a lot being put on people where we've got to go, 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 go. We've got expectations and standards where I've got to see so many patients, or they're ringing their buzzer or their bell, whatever, and they're needing help and they're needing help, and it can be hard to say, so you want me to be patient and you want me to stop and listen? Yeah, maybe it won't be in that moment. But you know what? I would take if a nurse said to me, listen, I want to hear you, I want to listen, and I want to be able to answer your questions. I'm swamped right now. Can you give me just a few minutes? Would that be okay? Absolutely. There's always going to be that small percentage that no matter what you say, they're going to try and make your life miserable. That's life. That's people. But we're all human. And communication is how we navigate this world. So there are times when you hold something, or at least your advice or your guidance. I think back to the hospice nurses, and oh man, if anyone listening is going in that route of being a hospice nurse, you are a blessed individual. It is amazing the work that they do, and they were the pinnacle of I'm going to stand here until you ask me a question because I know you have questions. And but
Mm-hmm.
it was that moment. But they could, right? In that environment, in that context, they could. But again, that whole ability of there's no training manual for this. You get it because you're being trained to do this job, but from a family's perspective, there's no manual on how to deal with loss. There's no manual on how to deal with sickness and all of this stuff. We're all learning. And so I think if we had that understanding, it gives us a lot more opportunity to be patient, to be willing to explain. And even if you have to explain it a couple times, that's kind of part of it.
Yeah, what a great perspective. And I think a good thing for students to just, as they go into their new nursing roles, just tuck that in the back of your brain and let that be context that you use every day when you're caring for somebody. Um, I really like that a lot. So, okay, let's shift gears a little bit,
Yeah.
because we don't only have conflict with patients and families. Unfortunately, we're going to maybe have those a little bit with coworkers too. So, new nurses, especially, may struggle with speaking up or advocating for themselves. So, what advice do you have for navigating that peer to peer situation where there may be a disagreement or miscommunication?
I go back to one of my favorite kind of viewpoints on this, which is character development and focusing on the character dimensions, character traits. Who do you want to be known as? If you were to take yourself right now and think 20 years down the road, 30 years down the road, what do I want people saying about me and how I navigated conflict, how I managed my relationships, et cetera, et cetera. And if I'm somebody who's like, listen, I want people to know me as someone who is honest, they held themselves and others accountable, they were responsible, and they were direct when they needed to be, then I need to then think about how do I get there? I I can't say 100% because I haven't walked in your shoes to say I get it. But being a new employee before, there are times where I didn't want to be that person. I didn't want to ask a question and be perceived that I didn't know what I was doing. Some great advice a mentor gave to me. There's no such thing as a dumb question if you don't know the answer. It's just not. You are going to have conflict with your peers. So, spoiler alert, you are going to have conflict with your peers. There is no perfect team, there's no perfect setting. Everyone has off days. And so, I want you to start thinking, how do you want to show up in those moments? You have leaders for a reason. Unfortunately, there are bad leaders out there. As much as it pains me to say that, there are bad leaders who won't take you seriously, who won't listen to you, who will try to bully, who will try to put you down. So then you've got HR, right? There is always a layer. That's what I like to encourage people. There's always a layer. It starts with yourself, then your peers, then your immediate supervisor, then their supervisor, and then on the side is HR, right? And all this stuff. But I think here's the key thing. If I'm having a conflict with my peers and I go to HR, right? And again, I don't ever want to discourage someone from doing it because their role is to be able to support and guide and help mediate and do all that kind of stuff. But one of the first things they're going to say is, did you talk to that person? Again, spoiler alert, their first thing is going to be, did you talk to that person? So if you're looking at a conflict and saying, I don't want to deal with that, so I'm going to go to HR and make them do it, it's not going to happen. So we've got to think about, how do I want to show up? I need to have the conversation. Maybe you ask your supervisor, would you mind mediating? Maybe you ask a peer that you trust, would you mind just sitting in? Think about different ways that you can connect with people. I get it. It's going to be uncomfortable. It's going to be kind of awkward. But the thing is, you've got to own that conflict. Don't let it build. Don't let it build. One of the reasons that I left law enforcement is because I couldn't trust my partners anymore. And that's because I had conflict with two of them and I never addressed it. If I could go back, right? That's always the thing. If I could go back, I never addressed it with them. And then there came a call, a really violent call that I was on. And when I called for help, they didn't come
Oh, wow.
because of that issue, that conflict we had. And I never owned it, I never addressed it. And that was the reason I left law enforcement. And I look back on it and go, man, I wish I would have, right? So a lot of times we make conflict worse ourselves. So own it, address it. It's not always going to work out where they go, oh my gosh, thank you for bringing it to my attention. Everything is better. It's not going to happen that way. It's going to take time. But I go back to, how do you want to show up? How do you want people to know you as a person? And then what do you need to do to bring that to life?
That's great. And I hear too another opportunity for that personal reflection. So you've got to have a
Yeah.
little bit of thought into that before you step into these situations. And I mean, it can be so empowering to have the confidence you need because you understand that you understand what your end goal is and who you are and who you want to be. So if we talk about conflict, in the context of leadership, how can strong leaders step in to support a healthy work culture? So I know we're talking about nurses, we're talking to student nurses going into their nursing profession,
Mhm.
but there's been times where you're going to be in formal leadership roles, times when you're in informal leadership roles. So if we just think about you leading in general, if I'm going to be leading from my position wherever I am, um, how do we help to support that healthy work culture from wherever we are?
Communicate. Communicate, communicate, communicate. I tell leaders, especially brand new leaders, that what I want you to do with your team is I want you to be what's called the CRO, Chief Reminding Officer, especially when it comes to our mission, our vision, our purpose, the expectations. I want it so that when you walk into a room, people roll their eyes because they know what you're going to say. That's the kind of communication I want you to have. So much of the team conflict needs to happen. There was another great segment that I listened to the other day, and they were talking about meetings. And there's a big push. I actually, the Harvard Business Review actually writes about all of this stuff. Almost every magazine in there is about this kind of stuff. And one of the recent trends that I'm seeing is them telling leaders, and a lot of different authors telling leaders, get rid of your one-on-one meetings. And I
Mm-hmm.
find that really interesting, unique. And their reasoning behind it is because they say weak leaders rely on one-on-ones, strong leaders can lead their team. And here's what they mean is that if I'm a weak leader in front of my team, the only way I can talk strategy and movement is in those one-on-ones. Where if I'm worried that people are going to talk back to me, they're going to be rude, they're not going to listen or anything, then I do it in one-on-ones. But a strong leader is able in front of that team to set those expectations, communicate the vision, communicate all that, those parameters in which they need to operate. And so that's just one kind of side interesting lesson is we've got to make sure that we're able to let people know what it is, and it's not personal. That's the other thing. It's not personal. There's a very fine line between professionalism and personal, right? And when we go into conflict, for whatever reason, we default to personal. And
Mm-hmm.
so we've got to be able to step back and say, especially as a leader, is this personal? Is this professional? If it's personal, go figure it out. But if it's professional, we need to address it. We've got to talk through it. What are the symptoms of it? What are the other considerations that we need to make so we can strategize how we want to fix it? So, as a leader, for all of you who are listening that will be leaders, the moment you graduate, the moment you step foot on that hospital floor, whatever that looks like, communicate. That is the best thing that you can do. So if you want to avoid conflict, if you want to do that, tell people your expectations, tell people kind of the standards, right? But understand that there needs to be a willingness, kind of a flexibility that needs to happen because we're not all the same.
Yeah, one of the situations where I can see this being very tangible and applicable to our listeners is, nurses are considered to be the coordinator of care for the patient on a daily basis. That's a major part of your responsibility. You're coordinating care for the patient, their caregivers, but also communicating with the physicians and physical therapists, respiratory therapists, whoever's involved in that care situation. And that is a prime opportunity to be that strong leader who communicates over and over and over again, provides the reminders, makes sure that everybody that is involved in that care understands the plan, changes in the plan, gives their opportunities for feedback. I think that's a real tangible experience that these individuals, our listeners, are going to have from day one, where they can apply what you're talking about. So,
Well,
oh, go ahead.
I was going to say there's just one other thing that I wanted to add. And when I'm talking about communicate, be real.
Mm-hmm.
Be real with people. I was meeting with a leader the other day who was really struggling with the number twos underneath them. They're supervisors that fall underneath them. And as we were talking, she was saying to me, I just don't feel like, this person's doing what I'm asking them to. I don't feel like they're meeting the expectations. And I just said to her, I said, have you had that conversation right there with them? Well, no, because I didn't know if I could. Be
Mm-hmm.
real. Listen, here's what I'm feeling. Here's what I'm seeing. What do we do? Right. And so I want to make sure that I really get that point across is be real with people. You can have those conversations where, listen, I've talked to you about this, or listen, it's evident there's a conflict between us. How do we resolve it? How do we fix it? So don't ever be afraid to just be real and
Mm-hmm.
use your language with people.
Yeah, that gets us off into a little bit of conversation about authenticity too, but we'll stay
Yes.
on track here. Okay, so what advice do you have for new nurses who are going to be navigating? We don't want to do that. Navigating peer conflict or incivilities. Unfortunately, in the nursing world, there's historical issues
Yeah.
with incivility, and it's something that's still. I think there's a stronger push, maybe than ever now, to try to address that because we've seen such an increase in workplace violence. And I think we think about that a lot of times from patients and family members, but the incivility between peers fits into that category. So, unfortunately, it's probably going to come up. Hopefully, most of our graduates are going to work in environments that have a strong culture and that doesn't tolerate that. But let's say a situation arises. What kind of advice do you have for that?
This is difficult only The reason I say that is because based on the experience that I've had, and one other element is when I first got into staff development and training and development, I worked for the Department of Corrections up in Wisconsin. And one of the issues that we ran into was in one of our medical units, and the nursing staff, shift one to shift two, they were sabotaging the work because
Mm,
of the incivility that was happening, shredding records and doing all this. I mean, bad stuff. There were
wow.
a lot of elements to this, but how do you even come back from that? And one of the things that I've learned is I wish there was a super simple golden answer that I could give that just says communicate, right? I've been saying that a lot, and I wish it were that easy. The reality is, and I guess what I would offer is don't give up. Don't give up on it. You're going to get frustrated. There are going to be situations, but speak up. The moment you hold it in and say, no one's going to listen, no one's going to do that, the moment you believe that, then I don't want to say lost, but you're losing momentum at that
Hmm.
point. Use your resources. There are lots of resources. There's human resources. There is legal counsel. There are ethics lines. There is EAP. There are all these others. But the bottom line is if you are in an environment where people are treating you poorly, you're being treated negatively, then I'm always going to ask, have you given your best effort to try and resolve the situation? Meaning, have you leveraged the resources that are available to you? And if you say to me, you know what, I have. I've gone to HR and they told me nothing we can do. I've gone to my supervisor, they said nothing we can do. I'm having this happen. Then you know what? Sometimes the answer is you've got to go find a different culture. You've got to go find a different place. A lot of times people are really nervous about that. I don't want that to be your first option. There are
Right.
going to be bad days. Please
Yes.
don't. I had a bad day. Boom, I'm going somewhere else. Please don't do that. We are
Right.
not advising that. You're going to have your bad days, but put an effort into it. Don't just simply give in and give up. Good days are there. You've got to be patient, right? But also don't allow yourself to be in a situation where, you are being treated so negatively that it's affecting you. So that was a lot. I wish there were an easy answer because every situation's so different. But what I would say is know yourself, know what you value, know who you are, don't give up, and put your well-being in front of everything. I've never blamed anyone, and nor have I ever been blamed for leaving because I just wasn't in the right I wasn't on the right bus. I wasn't in the right
Mm,
situation. So don't give up. It's going to be hard. You're going to have hard days, but I also know there are going to be good days as well.
right. That's a good point. And I think, as a part of those, making sure that you've evaluated all your options, you've taken advantage of all of those, and not just holding it in and allowing it to happen is starting with an attitude of zero tolerance. Incivility exists and survives because people tolerate it and they accept it. And so if we collectively decide that we're going to have zero tolerance for it, well, it's not going to continue on. So sometimes that's setting a zero tolerance standard for yourself, is where we start, but ideally that's the culture that we're working in. So um, one big part of conflict resolution is problem solving. I think that's kind of a theme that's coming up as we're going along. So it's really the same process that we already use in nursing. And when we think about problem solving, we have what we call the nursing process, but we start with assessing the situation, weighing your options, making a decision, and then evaluating the outcomes. So um, when we look at that, what's the key to effective problem solving and working through those steps?
I love that process. And, there's nothing about that process I would say anything differently to. I would only add on to that and really want to enhance it. And how I would do that is find a mentor.
Mm,
Find somebody that you trust. Make sure you have a network. And that builds into, and it really enhances what you were saying about having that zero tolerance. Because you're right. The reason we have it is because we tolerate it.
mhm.
But find a mentor. You're not going to know everything. Find someone you trust, right? And as you're navigating that problem solving process, be willing to talk to people about it and say, what have you experienced? How might you handle it? But specifically to your point, when you assess a situation, I would encourage you to remember, think of the different perspectives, the different viewpoints that are there. Remember that we're all seeing it a little bit different. We all have different lived experiences. One of the common challenges I see in teams today would be generational differences. And I know
Hmm.
all of your students are going to experience, not if, they will experience this. And one of the common themes that I see is, those that have been there 5, 10, 15, 20 years, whatever, they get mad at the new ones. Well, they don't know what I know. They don't know. Of course they don't, right? But here's the thing, just like a brand new employee who's been there 2 weeks isn't going to know what you've learned over 30 years, you also don't know what they know because you weren't raised in the same era that they were. And so there's always going to be an opportunity for perspective. We've just got to be willing to listen to it. So, assessing the situation, ask yourself those questions. What assumptions am I making? What perceptions do I need to consider? And what expectations do I have around this? So, again, assumptions, perceptions, and expectations. When you're making a decision, again, know who you are. What do you stand for? What won't you tolerate? And then you've got to be able to act on that. So, those are some of the key things that stand out for me.
And that sounds good. So in part of problem solving, we also want to touch on the concept of negotiation. So
Yes.
I think that's a big part of it too. And even when we talked about like the conflict resolution, there's some we're going to have a little give and take on both sides, hopefully to come to a good solution together. But negotiation is going to be a part of that. So can you break down the different approaches to negotiation and what works best in practice?
Obviously, what we want to do is we want to find a win-win situation, right? Two heads are better than one. I want to make sure that you're successful. I want to make sure that, I'm successful as well. And so, as we think about this idea of negotiation first, it's something you do every day. Don't forget that. You do this every single day. We negotiate all the time. And so don't make it bigger than it really is. What is your end goal? And a lot of times when I'm in a situation where there's a disagreement or a conflict, I'll actually stop and say, listen, here's my end goal. What is yours? Because there may be times we have the same end goal. It's just how we're going to get there is going to be a little bit different. We can work with that. So don't lose sight of your target, of your goal, right? It can be easy to become frustrated when somebody sees it differently than you. Here's what I would encourage you not to do. Don't withdraw. Don't avoid it. You've got to address it, right? You've got to be able to tackle it as you do. You'll hear other things in negotiating where people will try to soften it. They'll smooth it. They'll use this smoothing phrase. And really, what we're trying to do is, I just want to satisfy you enough so I can kind of get my thing in. I just want to keep the peace, right? We want to
Mm-hmm.
avoid doing that. If you've got an outcome or an objective, that's what we're working towards. Where are you willing to budge, right? Where are you not willing to budge? We've got to know that. Competing in coercion. Now, my academic background is heavy in servant leadership, and I do a lot of work on what Robert Greenleaf tells us, who's the modern day founder of servant leadership, and he talks about this idea of persuasion versus coercion. When we think about persuasion is working with people, talking to them, getting them to go along because they feel, hey, this is the right thing, right? You can kind of persuaded me to think this is a good way. Coercion is, I'm kind of putting the blinders over you, right? I'm going to say what I need to say to get you to do what I want you to do. So we want to stay away from that coercion part. Ultimately, it comes down to cooperation. What are we willing to do? You're not always going to get your way, right? So, what do we need to do in that moment to be able to get to where we need to? Remember, there's always the after action review. There's always an after action review. Get through what you need to get through and then talk about it because learning is all around you. So, be willing to consider that as well. But ultimately, be willing to collaborate. Listen, again, we're all going to have different perspectives. That should make us stronger, not separate us.
Yeah, that's great. And that collaborating win-win approach, I mean, it just works best for everybody. And when we try to compete and we want to be the one who's right or we want to be the one who wins, that can lead us down a road to conflict rather than problem solving in the situation. So I know everybody's got a different personality, and assertiveness can come easier to some more than others. I know that you know this about me, and it might be a surprise, but my assertiveness is not exactly high on my preference in communication. So, how can we be assertive without sounding aggressive? Because I think maybe sometimes we think assertive and we think this association we want to make is that aggression, which that's not necessarily what it is. We give it a negative context. So, when we're new, maybe we're not the seasoned expert, our confidence level may not be high. How do we still be assertive in those situations?
There's a great strategy. So I referenced earlier a book, Crucial Conversations. That same company, Crucial Learning, wrote a book, Crucial Accountability. And Crucial Accountability, while the Crucial Communication is a red cover, the Crucial Accountability is a blue cover. So if you're looking for them, that's the difference. But in there, they talk about how to have accountability conversations. And so a lot of it connects to what you were just saying there. One of the strategies in there is what they call make it safe. I don't want to do this. I do want to do that.
Hmm.
So it goes back to how we communicate. Be clear to say, I'm trying to figure this out, right? Let people know what you're wanting to do. If I'm being assertive, or I need to be assertive, where this is what I need to get done. No, you don't need to do it. Here's what I'm trying to do. I'm trying to do this. I'm not trying to upset. I'm not trying to do anything. I'm trying to do this. Help me get there. And there have been times where I've been frustrated and I'm working with people and I'm trying to get to an end goal, but I need them, right? They are the key to that lock, that door, right? And so I'll actually say to them, listen, I am trying to get here and I really need your guidance. Help me get there. Would you be willing to help me get there? Right. So it's about that collaboration, that openness, but that communication. There are going to be in the heat of the moment, we're going to say things, we're going to react, we're going to do things. There's always the after action. I have apologized to people many times. I was thinking about how I responded in that moment. I was probably a little more assertive or a little more aggressive than I should have been. I apologize for that. So you can make a lot of things right by owning your ownership, things of that nature. But who do you want to be known as? What are you trying to accomplish? And communicate. Be willing to change up your communication. It's just like when you're talking to a patient, you're going to explain things. And my dad would always say to the nurses and doctors, treat me like I'm a kindergartner, right? And so it was always kind of funny. But sometimes that's what we need to do, right? What aren't you getting? What more do I need to tell you to help you get there? So yes, at times you're going to come off aggressive. Yes, you're going to come off assertive. But what is your intent, right?
Hmm.
And be willing to explain it. Listen, my intent is to do this. Boom, just a couple seconds. People will say to me, "Oh, but in high stakes situations, I don't have time." Yeah, it only takes a second or two. You do, right? And again, especially if it's for the betterment of the patient, it's a betterment for the person you're caring for. You got time, right? Do what you got to do.
Yeah. I know we're talking about this in the context of patients, but I think I might have to use that on my husband. So,
Wait now,
okay.
hold on, hold on.
Okay. So when one topic too I want to touch on before we wrap it up here is the concept of grievances and the grievance
Yes.
process. So sometimes we've talked about informal strategies for resolution, for negotiating and all those things, but sometimes those just fail. And you kind of mentioned this earlier when I talk about incivility and the need that at some point, we take ownership, we try to do our part, but we can't control the other person all the time, well, ever. And we may not, the outcome may not go the way we need it to go. So if you could help us understand what is a grievance and how can our nurses or our new nurses feel supported in going through a grievance process?
So grievances are perceived wrongs. Maybe perceived isn't the right word, but these are things that we've been wronged, right? I'm
Mm.
filing a grievance because I was treated poorly. I'm filing a grievance because of this. So that is going to be a formal documentation of the issue at hand. When you are filing grievances, documentation is critical. Please, please, please hear me when I say documentation is critical. And here's what I mean by that. Let's say I have a verbal issue with someone. So it's not an email, it's not over the phone, it's not anywhere where I could record it. But let's say they've been talking down to me, they've been treating me bad. Keep a log, keep a note, right? Because if I'm going to try these efforts to navigate a conflict and it's just not working, just not working, just not working, and then I go find a grievance, don't walk into HR or whoever you go to and say, this is the 13th time they've done this. I'm filing a grievance because they're going to say, where's the evidence of all the others? And if you can say,
Mhm.
listen, I've been keeping a log, documentation is so important. It can be really informal. One of the best strategies I tell people to do is write yourself a note via email, drop it in your calendar if you have a separate calendar, or put it in a folder, but just put a quick email on this date and this time, this is what happened. Boom, that's all you need. That's all, that's the length. And I talked to so and so and they told me to, go apply somewhere else or whatever it may be. But documentation is going to be key. You've got to be able to check your emotions. Emotions are going to get in the way of this. You're going to be upset, you're going to be mad, you're going to be angry, but you've got to be a neutral. That's what
Mhm.
external parties are going to be looking for. We want to look at it through a set of neutral eyes. I'm not saying that to discredit a grievance, but what I'm saying is you've got to remember if I write a report and it's somebody neutral who's reviewing it to say whether or not this is true, you've got to realize they're going to have a neutral perspective. And so you need to approach it in a neutral and fair manner, if that makes sense. So again, when you're filing it, details, make sure you review your company's grievance policy. Make sure you know it. Right? Because, and there are some that you want to just have and you want to review. Again, my hope is you never have to, but if you do, documentation and neutrality are going to be key.
Yeah, it sounds like taking an objective perspective and really sticking to the facts of the
Mhm.
situation are going to be important in that documentation too. So, okay, thanks for touching on that because that's a topic that we want to cover. Hopefully, we don't ever have to go that route, like you said, and that those informal resolution processes can help before we get there. But it's good to understand what they are, and especially the emphasis on looking at the policy. So that wraps up, our conversation. It's been a great conversation. We've covered a lot from understanding the roots of conflict to practical strategies like assertive communication and negotiation and even that grievance process that we talked about. So I promise students that while all this information is fine and good, I will bring it back to what might this look like on an exam because at the end of the day, I think that that's probably high on their priority list is making sure that they pass their exams. So I know that you are, you're not a nurse, you don't take the NCLEX, but would you be willing to work through a couple NCLEX type, or board exam questions that would show up on that exam to give students an example of what they might see?
I would love to be the example, even if I get every one of them wrong.
Awesome. I like the attitude here. Okay, let me get these questions pulled up for us and share my screen here. Give me just 2 seconds. All right. Okay, so I have three questions for us here, and I have a feeling you're going to do pretty well with these. I think these are, if we understand the concepts of conflict resolution, we're going to be good. So I'm going to go ahead and because we may have some who are just listening and not viewing this, so I'm going to go ahead and read the question and read the answer choices, and then you can take a stab at it and let us know what you think. So, all right, question number one. A healthcare provider is screaming at the nurse in the hallway and says, "Why didn't you get that surgery scheduled sooner?" What is the best response by the nurse? A, "I'm so sorry. I will get this fixed and schedule the surgery immediately." B, "I am uncomfortable with your tone. Please excuse me while I locate my supervisor." C, "I delegated this task to the unlicensed assistive personnel. Please follow up with them." Or D, "I think you're overreacting and you should have specified the date and time." So,
Oh boy, I'm going. There's so much I want to say on this one. I so there's a couple things that I'm thinking of, and I'm going to target A and B on this one, but I will give you an actual answer so you can tell me I'm wrong. But
okay.
when I think of A, there's a level of ownership there. Hey, I am so sorry. I will get this fixed and schedule the surgery immediately. If this is a area of responsibility for me, that's going to be the best route. But there's going to be an extension to this answer because I'm going to follow up with them. And I'm going to say the way you handled that was unacceptable, right? That
Hmm.
screaming element. But then I'm also leaning towards B because I am uncomfortable with your tone. Please excuse me while I locate my supervisor. What I don't like about that one is please excuse me while I locate my supervisor. That's a passive response. That's now pushing it off, and you're not taking the ownership. So I'm going to go with A.
Okay. Well, in this case, our answer is actually going to be B. But I
Oh.
think I know our students, my students are probably like, yes, this is how I feel every time I answer one of these darn questions. So the thing that we want to highlight here is the lateral violence, which is
Mm,
unacceptable. And it's what we would define that as an act of aggression from a coworker against another coworker. In this case, the healthcare provider, whatever level they are, they're a coworker, right? We're both working on the same team to provide care for these patients. And it's an opportunity where the nurse is going to use assertive communication and a direct approach to minimize miscommunication and inform the healthcare provider in a professional manner that the behavior is not tolerated. And so, in addition, the incident should be reported to the immediate supervisor. Now, I do track with your train of thought and where it's like we've got two things that can go together from A and B. Too bad it's not select all that apply because we do need to fix the issue about the schedule and the surgery. But what I want to highlight and the focus is, that accountability for how we communicate with each other is really the key thing here. So, in my rationale, for option one or A, apologizing is a form of non-assertive communication and disregards the nurse's feelings and
mhm,
permits the violation of their personal rights. So, you know, when we think about this too, I'm going to use this as a little teaching moment for my students that, uh, sometimes we can easily read into a question and our brain wants to jump to something. And we don't know for sure that the nurse actually did anything wrong here. It could be a miscommunication situation. But by apologizing, it's in some ways giving permission for that person to speak to them that way. So something we want to think about. The nurse can offer a blameless apology, and I think this is a really good practice to have because I know in my own, I'm a peacemaker, and I always want everybody to feel peace and feel good, and I don't want problems. And so I apologize for things that I didn't do sometimes, and
mm,
so or that don't need an apology. And so, in this case, having a blameless apology, like I'm sorry, there's a problem, like there's a problem. I'm sorry that problem existed, but it takes it away from that personal attack. And then here for option three and four are obviously incorrect. We would not delegate this to unlicensed assistive personnel because that's not within their scope of practice. So the nurse would be in trouble because they shouldn't have done that in the first place. And then D is going to be a blaming, so you are overreacting. This is what you said about I statements, right? We don't want to accuse somebody else of doing something. So in this case, the objective we want to get to here is the situation with the assertive communication, and minimizing the opportunity for miscommunication and not allowing for this type of, you know, approach to continue. So, okay. Are you willing to move on to
It's
another one?
yes, and it makes sense. Because just as you had explained, if I naturally respond with the "I'm so sorry, I'll get this fixed," I've just given them permission to talk to me like that, and I think that's
Right.
the big thing, right?
Right.
Even though we want to help, we've got to think about their behavior, right? What are we
Mm-hmm.
willing to tolerate? So I don't know. I'll go with you on this one and say, yeah, I agree.
Okay.
It's B. Yeah, totally.
Sure. Well, and I think, to your point, and, to really encourage students as you're studying, taking this content that we're learning in this class and preparing to apply it to an exam, this is how you're going to see it. They're not going to ask you, what is define a blaming behavior or from this list. It's not going to be that direct. So you're going to need to take some of these principles that we've covered and apply them to situations where we pick the best way to handle whatever situation is presented in the question. So okay, let's move on to another one. All right, in this case, A nurse is caring for a client who is recovering from surgery. The client's daughter approaches the nurse at the nurse's station, visibly upset, and says, "No one is telling us what's going on. This is ridiculous. I want to speak to someone in charge right now." Which response given by the nurse demonstrates effective conflict management? Is it A, "I understand you're frustrated, but yelling at the staff won't help"? B, "You'll need to wait until the physician rounds later this afternoon"? C, "Let's step into a quiet space so we can talk and I'll do my best to answer your questions"? Or D, "There's no need to be upset. Everything is under control"?
Oh, okay. So when I, again, going off of a personal example,
I know how
I was
timely. This is
I
good.
was given B.
Mm-hmm.
You need to wait until the physician. That was wrong, so I'm not going there.
Sure.
The let's step into a quiet space so we can talk. I think about safety as well, and so I would be concerned about wanting people to go out of the main space, right? If someone's upset, simply saying there's no need to be upset is kind of accusing. So I'm going to go with A. I understand you're frustrated, but yelling at the staff won't help.
Okay. Because I see where you're going with this. Because in A, you're wanting to address the behavior, right? That yelling's not going to
Oh,
help.
I'm wrong again
How could you tell that?
because.
Okay.
Okay, I'll let you
Okay.
go ahead. I'll let you go ahead.
So A comes off as confrontational, right? So think of yourself in
Okay,
the
I see it.
family. Yeah, right. So you gave us a really good example from your own personal situation that happened recently, which
Yeah.
I did not tell you these questions beforehand, which is really cruel of
No.
me and why we're here doing what we're doing now. But how what a perfect
Mhm.
correlation to the experience you said you had. So, when you're when your dad was frustrated, or you came and said, "I'm not happy with this." If the nurse responded with telling you, not addressing what you were frustrated about, but telling you to stop yelling, you know, I don't know. I have a hard time with this one because we just talked about why we don't want to tolerate that kind of behavior.
Yeah, exactly.
Um, but we also, I don't it's once
Well,
again that confrontational and blaming approach. Were you going to say something?
yeah, because I'm now again, this is in my testing mind, so I'm looking for the same words here. And so, okay, I get it's not A. So would it be D?
No, because we could give some false reassurance there.
Yeah, that's
I
true.
think you're focusing on the safety aspect, but what we want to think about in C, which is actually the correct answer. C, it gives some assertive communication. It provides de-escalation techniques. Let's
Yeah.
move away from here. Let me give you an opportunity to answer your questions, right? The quiet space is not necessarily a closed in space. It's just not at the nurse's station, right?
Hmm.
So we're being assertive. We're saying, you know what, this is what we're gonna do, and we're gonna remove ourselves from this location in this situation. We're gonna bring it down, and I want to hear what you have to say. Tell me what it is that you feel like, ask your questions. Don't have to even restate to tell me what you feel like is wrong. But it acknowledges that family member's emotional state.
Hmm.
It gives a private setting for discussion, which is going to then reduce tension because sometimes it can fuel the show there, and it gives a willingness to problem solve. So that's what makes that be our most correct answer. Welcome to nursing school, where we provide you four answers and you get to pick the best out of the four possibly correct answers. So, okay, I think that B, I want to highlight this deflects responsibility. So
Hmm.
yes, as you already pointed out, you experienced this and that's not okay. C, is dismissive because it's kind of dismissing, like just saying, telling the patient's family member that you're wrong. Like, you don't need to be
Mm.
upset. Everything's fine. What are you talking about? Right. So, okay, I'm going to owe you something really big for having to do this.
Well, it depends if I can get one out of three.
Okay, let's see.
So,
I'm feeling good about this. Okay. A newly licensed nurse is assigned a heavier client load than other nurses on the unit. The nurse feels overwhelmed and speaks to the charge nurse, who responds, "Everyone's busy. You just need to manage the best you can." Which initial response made by the nurse is most appropriate? "This isn't fair. You gave me more clients than everyone else." "I'd like to talk to the nurse manager about this assignment." I understand the unit is busy, but I'm concerned I won't be able to provide safe care with this assignment. Or, fine, I'll try to make it work, but I'm not happy about it. So,
All right, so here's what's leading me. So, when I think about this isn't fair again, that's just going to create conflict. I'd like to talk to the nurse manager about this. To me, I don't feel like you're giving the opportunity for the nurse and the charge nurse to actually negotiate and figure this one out. Fine, I'll try to make it work is a little sarcastic, a little snappy. I'm going to go with C, only because, when we've got employees who say, listen, I'm overwhelmed and they're new, right, which is unique in this case, then we've got to make sure that we're clarifying what it is that they're doing so that they understand. So I'm going to go with C. I understand the unit's busy, but I'm concerned I won't be able to provide safe care with this assignment.
awesome. You are correct. Yay! You got it. I had faith in you. I knew that you could do it. So, your rationale on all of it, I think, is great. The first response is using accusatory language. It focuses on fairness instead of patient safety. And like you said, it can cause an escalation in tension that's not, assertive, the appropriate type of assertive or constructive. For B, the first attempt is going to need to be resolve the conflict directly, and I think that's something a lot of people have a hard time with. We want to jump to, I don't want to have to address this conflict myself, but that needs to be our first attempt. D is passive, and it like you said, snarky, and it's not going to help anybody. So C is going to represent some assertive communication because you're speaking up for yourself and the situation that you're in by expressing concern respectfully and focusing on client safety. Because at the end of the day, it's not about what I feel here or what I don't like or whatever it is there, but it's about keeping our patients safe and making sure that we're providing the best care that we can. It's professional and it's patient centered. So fantastic job. I knew you could do it. So, all right. So I have one last question for you. I like to ask here, let me stop sharing this real quick. I like to ask all of my guests, what is the best advice you've ever been given?
That's a hard question, just because of just personally the growth and the opportunities and challenges that I've gone through in my life. And I think one of the best ways I can do that is recently a mentor of mine sent me a quote, and it's from Albert Schweitzer. And that quote is, I don't know what your destiny will be, but one thing I know. The only ones who will be really happy are those who have sought and found how to serve.
Hmm.
As somebody who is, passionate about this idea of servant leadership, of being able to, make an impact in the little corner of the world that I have, I think figuring out and identifying what your passion is and then going after that relentlessly, that's when you're going to find happiness and that's when you're going to find success. And I think, what I've also learned over the, years has been the power of patience and the power of curiosity. So that's how I'll leave that.
I appreciate that. That's great. And very, our listeners and our nursing students in the nearing the end of their program are right at the starting point of that pursuing their passion. And the sky's the limit as they enter into the nursing profession. So thank you for sharing that advice with us. So I really appreciate you joining me today. Your insight on communication and leadership and conflict resolution gave us a lot more than just theory. I think it gave us some really practical strategies and some real world wisdom that we can take as we move forward. I know I've got some things that I'm going to store away and use as I go into the upcoming days. So for my listeners, I hope that this episode helped you feel a little more equipped to face conflict head on. It's not easy, but it is absolutely something that you can learn to navigate well. Remember that conflict is not always a bad thing. When we handle it constructively, it can lead to stronger teams, better communication, and ultimately safer patient care. And whether you're a brand new nurse or you're an experienced leader, how you show up in the moments of tension is a big part of how you will lead. So we'll continue to build on these ideas throughout the course. Stay curious and stay engaged. And as you're studying for your exams, know this, that leadership and conflict resolution might not always be labeled that way on the exam, but your ability to respond with clarity and courage and critical thinking is what we'll be testing. So thanks for tuning in to Leadership Chats with Dr. Wise. And until next time, keep learning, keep leading, and stay curious. Thank you.